Hi, and welcome to today's video, where we will be talking about two extremely serious senior health problems: heart attacks and strokes. Heart attacks and strokes can both be fatal, but luckily, they can usually be prevented, and prompt intervention can save lives. In this video, we will cover the early warning signs, how to prevent these conditions, and what you can do to save yourself and your loved ones from these conditions. Section 1. What is a heart attack? A heart attack, or myocardial infarction, is when the blood supply that is rich in oxygen to a part of the heart is obstructed. This is usually due to plaque formation in the coronary arteries, which supply blood to the heart muscle. If the blood supply is obstructed, the heart muscle will not get sufficient oxygen and will start to die. Heart attacks can occur abruptly and be extremely severe, yet catching the symptoms early and seeking medical attention immediately can make all the difference. Section 2. What is a stroke? A stroke happens when there is an interruption of blood flow to a part of the brain. This can be due to a blockage, ischemic stroke, or a burst blood vessel, hemorrhagic stroke. Similar to a heart attack, a stroke can inflict severe injury on the body and the brain. Time is of the essence in both instances. The earlier medical help is administered, the higher the chances of recuperation. A stroke can result in long-term effects based on the part of the brain affected, and it can also be fatal in certain cases. Section 3. Heart attack and stroke risk factor. Shared attacks and strokes have many of the same risk factors, such as 1. High blood pressure. The excess blood pressure puts extra strain on the heart and arteries, making heart attacks and strokes more likely. Over time, it can also cause the walls of the arteries to become damaged and blockages to form. 2. High cholesterol. High cholesterol levels can cause plaque to accumulate in the arteries. This narrows the arteries and makes it more difficult for blood to pass through. This risks a heart attack or stroke. 3. Diabetes raises the risk of heart disease and stroke. Elevated blood sugar destroys blood vessels and the heart over time, making them more likely to clog or form a clot. 4. Smoking also harms blood vessels and speeds up the buildup of plaque in arteries. It also increases blood pressure, which is a factor in heart attack and stroke. 5. Obesity and lack of physical exercise. Being overweight and inactive can contribute to high blood pressure, high cholesterol, and diabetes, which in turn raise the risk of heart disease and stroke. 6. Family history. If you have a family history of heart disease or stroke, it can put you at greater risk. If your parents or siblings have had heart attacks or strokes at a young age, you might be more likely to experience these problems. 7. Risk of heart attack and stroke increases with age. While these are conditions that can occur at any age, older people are more vulnerable. 8. Gender. Men tend to experience heart attacks and strokes earlier than women, but after menopause, the risk for women increases and can surpass that of men. Section 4. Early symptoms of heart attacks. It is important to identify the early symptoms of a heart attack to rescue lives. Symptoms of a heart attack include the following. 1. Chest pain or discomfort. One of the most common symptoms is chest pain or discomfort, which may feel like pressure, tightness, or a squeezing sensation. This pain may come and go, and can last for several minutes. 2. Pain in other areas of the body. A heart attack can cause pain or discomfort in the shoulders, arms, back, neck, jaw, or stomach. It's important to note that the pain may not be confined to the chest alone. 3. Shortness of breath. If you find yourself suddenly short of breath, even without physical exertion, it could be a sign of a heart attack, particularly when accompanied by chest pain. 4. Cold sweats. Breaking out in a cold sweat, often along with nausea or dizziness, can also be a sign of a heart attack. 5. Lightheadedness or dizziness. A feeling of dizziness or lightheadedness, especially when combined with other symptoms, can indicate that a heart attack is occurring. Section 5. First stroke signs. Recognizing the signs of a stroke early can help prevent permanent brain damage or death. Here are the common warning signs of a stroke. 1. Sudden numbness or weakness. One of the most common signs of a stroke is sudden numbness or weakness. typically on one side of the body. This can affect the face, arm, or leg. 2. Sudden confusion or difficulty speaking. If you or someone else suddenly has trouble speaking, understanding what is said, or feels disoriented for no reason, it could be a sign of a stroke. 3. Sudden vision problems. A stroke can result in sudden vision issues in a single eye or both eyes, including blurred vision or loss of vision. 4. Sudden trouble walking. Difficulty walking, dizziness, loss of balance, or lack of coordination may indicate a stroke, especially if it comes on suddenly. 5. Bad headache. A sudden headache without a known cause could be a sign of a stroke if it is accompanied by other signs. Section 6. Prevention of heart attacks and strokes. The good news is that both heart attacks and strokes are largely preventable. By addressing risk factors early and making healthy lifestyle changes, you can significantly reduce your chances of developing these conditions. 1. Eat a heart-healthy diet. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help lower cholesterol, reduce blood pressure, and prevent heart disease. Limit your intake of saturated fats, processed foods, and added sugars. 2. Exercise regularly. Regular physical activity helps maintain a healthy weight, improves circulation, and keeps your heart and brain healthy. Aim for at least 30 minutes of moderate exercise most days of the week. 3. Quit smoking. If you smoke, quitting is the most important thing you can do to improve your heart health and reduce your risk of stroke. Seek support through smoking cessation programs if needed. 4. Regulate blood pressure and cholesterol. Regularly monitor your blood pressure and cholesterol levels, and follow your doctor's advice for managing them. This may involve medication, dietary changes, and lifestyle modifications. 5. Limit alcohol consumption. Drink too much alcohol can increase blood pressure and lead to heart disease. Drink alcohol in moderation, 1 drink a day for women and 2 drinks a day for men. 6. Manage stress. Chronic stress can contribute to both heart disease and stroke by raising blood pressure and increasing unhealthy behaviors. Practice relaxation techniques such as yoga, meditation, and deep breathing exercises to reduce stress. 7. Routine health checkups. Regular medical checkups are important to check your health and find any early signs of heart disease or stroke. Follow what your doctor says and take any medications they give you as directed. Section 7. Treatment for heart attacks and strokes. If you or someone else experiences a heart attack or stroke, it's important to seek medical help immediately. The faster medical intervention occurs, the better the chances of recovery. For heart attacks, treatment may include medications such as blood thinners, clot-busting drugs, or procedures like angioplasty or bypass surgery to restore blood flow to the heart. For strokes, the treatment will depend on the type of stroke. Ischemic strokes are typically treated with clot-busting medications, while hemorrhagic strokes may require surgery to repair the ruptured blood vessel. In both cases, rehabilitation, including physical, speech, and occupational therapy, may be needed to help individuals recover and regain their independence. Conclusion. In conclusion, both heart attacks and strokes are serious health conditions, but with the right prevention strategies and timely intervention, the risks can be reduced and lives can be saved. By recognizing the early warning signs, managing risk factors, and leading a healthy lifestyle, you can protect your heart and brain health and enjoy a longer, healthier life. Stay heart healthy and take care.